My name is Dr. Michael Lee. I'm the co-founder and chief medical officer here at Landmark. My dad was a doc in small-town Massachusetts, and I remember seeing him go and see patients in their homes when they couldn't make it out to the office. And that always stuck with me, that he made the patient the center of the universe and came to them when they couldn't make it to the office, and always stuck with me as a bit of a golden era of medicine. And so went and worked as a hospitalist, but I kept seeing patients that revolved back and forth in and out of the hospital, and it just didn't make sense to me. So I just thought, what the heck, why don't I just go see patients in the home like my dad did? And it's very eye-opening when you see patients in the homes. You see the hoarding, the fall risk, the empty refrigerators, the lack of social supports, and just medications just sitting in a bowl as kind of their method of managing their meds. Then it makes sense. This is the real reason why they can't stay out of the hospital. We never saw these things in a 15-minute appointment in the office. And so ever since then, it's been a passion of mine is that instead of making a sick and frail patient come to the system and go to the PCP's office, then this specialist, then the labs and the pharmacy, let's bring the system, the teams, and the procedures to patients where they're at and do it 24/7, because patients' exacerbations and illnesses have no time clock. They can happen anytime, day or night, weekday or weekend, and so we need to be available around the clock to be able to manage their care. And so that was the philosophy in starting Landmark, that let's create a completely mobile medical group, bring the care to the sickest and frailest patients, and do it 24/7, so that whenever these patients who are just using 911 as their primary care, we can be there instead of them having to go to the emergency room, manage their illnesses, allow them to stay in their homes with their loved ones, and really optimize the care that they're receiving. Landmark was founded in 2013 by 4 individuals who had a concept and an idea that the sickest and frailest patients were falling through the cracks, and we needed a better system that focused on all the specific needs that they had, and really combining the medical, the behavioral, the social, and bringing that to patients where they're at 24/7. That was the genesis, and it's been incredibly rewarding to see the growth from those 4 individuals to now over 1,200 employees across 14 states, really delivering this high quality, very intensive home-based medical care to the sickest and frailest. And we're not just doing work that improves the lives of patients, we're doing life-saving work. We've done studies that have shown that for patients who are receiving the Landmark care, that their mortality rate is significantly lower than those who are not receiving the Landmark level of care. And so it's just really gratifying to know that we are helping patients live longer in their homes, surrounded by their families, with higher quality of life.